right, good evening, everyone. We are getting ready to be right up at the top of the hour. Just wanting to welcome and thank everybody for joining us for our LGBTQIA plus community conversation about Virginia's efforts as it relates to the COVID-19 vaccine. We have a good panel for you to hear from this evening, and also more importantly are looking forward to hearing from you all so that we could hear your questions as well as your comments as we're looking to engage and make sure that we understand the community's needs as we prepare for the COVID-19 vaccine. So just a little bit, I am Sable Kay. I am the Acting Director of the Office of Health Equity and Chair of our Health Equity Working Group, and also working as staff support for our fantastic Vaccine Advisory Work Group Communication and Messaging Group, which you'll hear about more in just a few moments. But to get started, I want to go over some housekeeping. Just love in the middle of a formal roll call to have you all introduce yourselves in the chat. These have been really great networking opportunities for folks, so just would love to have folks share their name, their pronouns, organizational affiliation, so that we can see who we have participating in the meeting today. And hopefully we'll be able to get folks to do that soon. And also, we're hoping that you all will utilize the chat box because you're going to be hearing a lot of great information. And also, we want to make sure that we can capture all of your questions. So feel free to, if you're seeing something and you hear something and that strikes a chord in your mind, please ask your questions and put them in the chat, and we'll address them during our Q&A. And thanks to y'all who are introducing yourselves. Wanting also as a housekeeping note to let everyone know that while we're in the information sharing time, your lines will be muted at the beginning of the meeting, but as we move forward into the Q&A time and also during the public comment time, we will unmute those lines after they're recognized for us to hear from you. And also, as this is a public meeting, this meeting is being recorded, and it's going to be shared on the our website and also shared with the participants, because we know that everyone is doing 1,000,005 things. So we want to make sure that we are making this available to folks who have to work or had other responsibilities that made sure that they couldn't participate in this time. So with that, I think that puts most of our housekeeping pieces behind us. But let's talk about one more thing. We have some accommodations that we've made for accessibility. Veronica, if you could talk about what options we have for folks this evening?
Yes, thank you, Sable Kay. Accommodations for accessibility on this evening are Virginia Relay Remote Captioning Conferencing. So I will be placing the link in the chat box for you if those services are needed. Thank you, Sable Kay.
Thank you, Veronica. And just want to let everyone know that we did make language interpretation available, but we did not have request for that accommodation for this meeting. And just wanted to lay out for people what you all can expect from our time together this evening. We're about to switch over to welcoming and remarks from Rose Miner, and then we're going to get a vaccine preparation overview from Marshall Vogt, who's an epidemiologist at VDH, and we're also going to have Kelly Vance give us a communications update. And after you hear from those folks, you all will have the opportunity to ask them questions and inform our communications and community engagement efforts. After that, we want you all to stick on because we're going to transition to our public comment portion. And to kick that off, we're going to have James Milner and Natasha Crosby start and initiate that process, and then it's going to be your turn. And everybody who is on the line today will have an opportunity up to a minute at a time to express a public comment. Perhaps there's a hesitancy, perhaps there's a myth that you've heard, but really just let us know how the Virginia Department of Health can best meet your needs in terms of information and supporting the community that we love. So with that, I am going to turn things over. This was our. I'm going to turn things over to to Rose Minor to give a update and to talk to us a little bit and provide welcomes from the governor's office. Rose, are you there?
Hi, I'm here. Can you hear me okay?
We sure can.
Awesome. Thank you so much, Sable, and thanks so much to the VDH staff for putting these community conversations on. My name's Rose Minor. I currently serve as a special assistant for community engagement and director for LGBTQIA plus outreach for Governor Northam's office. Super excited that everyone can join in today, and also just the news of the vaccine is super exciting as well. I've definitely been having like a smile on my face knowing that we are going to be in the process of moving, the vaccine out to Virginia and also across the country. And also a little bit still kind of nervous because I do know that we're still in a very vulnerable position with this pandemic. Also encourage everyone to go onto the governor's webpage. He did have a press conference today with some new restrictions because our positivity rate unfortunately has gone up. So there are some new gathering restrictions, I believe 10-person gathering for private and also public gatherings, as well as curfew from 12 a.m. to 5 a.m. And it excludes like people who are going to work, of course, or having to go to the hospital or trying to take care of other kind of essential needs. So I do encourage you all to go onto the governor's website to read the executive order, as well as to watch your local news channels tonight. And again, very excited that we're having this conversation. I know that the pandemic has affected this community, the LGBTQ plus community, a lot, as well as people of color, as well as the disability community. I know that there have been LGBTQ plus trailblazers who have unfortunately passed away in this pandemic, people who are highly involved in Stonewall, people who are highly involved during the AIDS epidemic, people who are highly involved in transgender rights. So, as we think about this vaccine, we want to, I encourage, when this happens, I encourage people to take it, to think about the people who were trailblazers in history, and to think that you're not only taking this vaccine for you, but also for your community, for your household, for all the people that mean or matter in your life, or even people you don't even know. And we take this vaccine and we keep on doing good work and deeds in their names. So again, I'm super excited to be in this conversation. I'll be taking notes. I put my contact information in the chat box, so if anyone wants to send me an email, please do so. Thank you so much.
Thank you, Rose. And for folks who share their contact information in the chat, we're knowing that you all want us to be able to share that. So when we get when we send out our follow-up after this time, you'll be able to get the contact information for those who wanted to share it publicly via the chat. And you'll also receive a recording of this conversation. Thank you so much, Rose, for those introductions and that welcome. And wanting to, while we're talking about items coming out in collaboration with the governor's office, I wanted to make sure that you all knew that this event is a collaboration between our Health Equity Working Group and our Vaccine Advisory Working Group. I'm seeing my sister in arms in the chat, Dr. Janice Underwood. She is leading our health equity efforts for the Commonwealth through the governor's office as our Director of Diversity, Equity, and Inclusion for the entire Commonwealth. So thank you so much for your commitment to equity and for being and joining us today. Also wanting to shout out, we have some really great members of our Vaccine Advisory Work Group who are on the call today. But this event is co-sponsored and is led by our sub-working group on vaccine communications and messaging. And I know that we have at least one of our co-chairs on, but really want to thank Galen Knoyton and Wendy Klein for their thought leadership and the time that they've taken to make sure that we are planning events such as this to engage the community and make sure that we're getting a diverse group of perspectives as we are looking to serve our communities during this time. So with that, I'm going to turn things over to Marshall Vogt to talk us through some of the great work that is happening at VDH. Marshall is an epidemiologist at the Virginia Department of Health, and he's also serving as branch lead for our COVID-19 vaccines operation unit. Marshall, the first thing I would love for you to talk about for us is just explain for the folks we have on the line what are Virginia's plans as it relates to the COVID-19 vaccine and distributing it across the Commonwealth.
Sure. Can you hear me okay?
Sure can.
Great. Well, thank you for having me here tonight. I really appreciate the chance to talk to this group and to share a lot of the hard work that's been going on, largely behind the scenes, in terms of preparing to get COVID-19 vaccine out to folks across Virginia, including to everybody who's on this call tonight. I don't think I really have to make the case for the need for COVID-19 vaccination. We've seen that COVID-19 has really impacted everybody, not just in terms of our health, but in the ability to go and lead our lives as we would want to visit with family, to visit with friends, and to be part of the community that we love and we know here in Virginia and across the country and across the world. There's a lot of different ways that we can control infectious diseases, and we've tried to flatten the curve with social distancing, with staying at home, with wearing masks, trying to keep distance from individuals and not be in crowded spaces. But we know that that's great, but there's something that could be better and could really help turn the tide in our fight with COVID-19, and that's a vaccination. And we know that vaccines are safe and effective. We've used them for thousands of years. If you go back, we've used them against smallpox, we've used them against all sorts of infectious diseases, and they've had a huge impact in society. And they allow us to keep diseases under control and allow us to really have a normal life, free of a lot of the horrible impacts of infectious diseases. And COVID-19 is no different. We have several vaccine candidates that are really encouraging. A couple of the leading candidates you've probably heard about in the news, the Moderna vaccine, the Pfizer vaccine, even the AstraZeneca vaccine, have an effectiveness of 70, 80, 90+%. That's incredibly, incredibly impressive for a vaccine, and will certainly make a large impact once we're able to get vaccine out into the population, and I think really will turn the tide with COVID-19. The trick, of course, is getting vaccine out to the population. And we know that that's a very tall order for a number of reasons. One, we won't have a lot of vaccine at first, and we're going to have to figure out who should get that first little bit of vaccine and how to really allocate and prioritize that vaccine until we have enough to really reach the general population. In addition to that, we want to make sure that as we're giving that vaccine, we're breaking down barriers and we're able to reach people who might not otherwise be able to reach or receive that vaccine. It's going to be very critical to think about that and really be purposeful in our thought with an equitable allocation of vaccine. And then also we know that not everybody likes getting a vaccine. Nobody loves getting a shot in the arm, but some people don't understand what vaccines are or might have a concern about the vaccine. And so we want to be sure that we're messaging and communicating to people that this vaccine is safe and it's effective and it will work, and it will be just one other thing in a whole array of different tactics we have to really fight back against COVID-19. So the FDA actually met today, and they, it looks like, are moving toward approving an emergency use authorization for the Pfizer vaccine. That's one of the two leading candidates for vaccine, and it's very effective. And so likely in the next few days, that will become official, and then CDC's Advisory Committee for Immunization Practices, or ACIP, will make a formal recommendation for the use of vaccine. At this point, the vaccine is really likely going to be recommended for adults. It hasn't really been tested extensively in children, but we also know that adults are really the driver of COVID-19 transmission here in the United States. When we look at who's going to be the first to receive the vaccine, we have a good idea of that based on how ACIP has met and made some decisions already, and that happened several days ago. The early phases of vaccine administration campaigns are really going to focus on two groups: healthcare professionals and those who live or work in long-term care facilities. So in other words, those that might live in nursing homes or assisted living facilities. We've seen disproportionately COVID-19 affect both of these populations. One, the healthcare workers, because they're on the front lines. They're exposed to COVID-19 day in and day out, in large part due to the work that they do. And then also residents and staff in assisted living facilities and skilled nursing facilities, because they're in congregate settings and they often have underlying health conditions or might just be older and more susceptible not only to severe illness, but unfortunately to death as a result of COVID-19. So with a very limited amount of vaccine to start out with, we're going to be focusing on healthcare personnel and staff and residents of long-term care facilities. Again, both skilled nursing and assisted living facilities. The Virginia Department of Health is working very closely with hospitals, healthcare systems, providers across the Commonwealth to find ways to connect people in these groups to vaccine. We know that not everybody in these groups might work in a hospital or live or work in an assisted living or long-term care skilled nursing facility. So we're finding ways to work with our local health departments and community providers to connect people to the vaccine. But we're also thinking about what's coming next. In further phases, we really want to target essential workers, teachers, grocery store workers, bus drivers, people that literally keep the lights on and keep this country running. They too have been disproportionately affected by COVID-19, and they are the backbone of this country and the industries that, again, really do keep things moving forward. We think that they're likely going to be the next group, along with people that might be older or have underlying health conditions, again, who are at risk of COVID-19 and very severe illness and poor health outcomes, including, unfortunately, again, death as a result of COVID-19 infection. What's encouraging, though, is that as we work to vaccinate these groups, and it will take some time, we might stumble here and there, but we're going to work as hard as we can to get vaccine to these people and to connect these people to vaccine. We're going to be thinking further down the road. And we have plans to open up vaccines so that everybody will eventually be able to receive vaccine, be it at your local pharmacy, your doctor's office, through a health department clinic. We have lots of different ideas and lots of different ways to get people connected to vaccine. And as we vaccinate more and more people, I think we'll start to see the end of the transmission of COVID-19. But it's not going to happen overnight. So we still need people to wash their hands, to wear their face masks when they're out around people, to try to keep distance from others and avoid those large events. The vaccine isn't going to come out overnight, and it's not going to change things overnight. But it's going to make a huge difference if we give it time and we keep up the fight that we've been doing so far against COVID-19. The health department, our medical providers, everybody that we're working with is really committed to making this a success. We want to answer questions, we want to allay concerns, we want to break down barriers, and we want to get vaccine to every Virginian so that all of us can conquer COVID-19. I'll leave it there, and I'm happy to take questions, and I know that Kelly and a bunch of other people have some stuff to share as well.
Thank you so much, Marshall, for that comprehensive overview of where things stand. I'd now like to bring up Kelly Vance from the Vance Sedal Group to talk with us through the communications plan. Kelly, are you there?
I'm here, Sable.
Excellent.
Thank you so much for inviting me to be here with you tonight. These community conversations are really, really important to the cause. I thank you all for coming here to share your questions and your concerns about the vaccine effort. It really helps so much. We're in the early stages, as you can see here. We're working with VDH to produce materials and orchestrate grassroots efforts to help people get the information that they need about the vaccine effort. And we're here right now to listen. We realize people have a lot of questions about the vaccines, and I and my members of the team are here tonight to listen to your questions so that we can ensure that the public education effort for the COVID-19 vaccine is useful and meaningful for all Virginians. We're also here because you're our first ambassadors. You know the concerns and the questions that can be the line of communication between public health and the people in your communities. We're really, really glad that you're here, and we need your help. I'd be happy to walk you through our general planning here, but I think that what we're really trying to do here is make sure that we are available taking notes. I have members of my team on the call to listen in, but essentially we want to prepare people for this with education. We want to build confidence, and a lot of that is going to be by listening to your questions and your concerns now, and And we are ultimately going to need you to be our best champions. So thank you very much.
Thank you, Kelly, and thank you, Marshall. So now we would like to hear from you. So we've gotten a broad overview of where the Commonwealth of Virginia is seeking to go, both with our vaccine distribution as well as with some of our communications efforts. So would now, excuse me, like to open up the floor to see if you all have any questions. You can feel free to write your questions in the chat, or if you would like to verbalize your question, raise your hand via the Zoom app, and then I can recognize you to make sure that we have a bit of order. So you can either put your question in the chat, or you can raise your hand and you can vocalize your question. Do you all have any questions for our EPI team and from our communications team? It's a quiet group, but people may be taking some time to type. All right, I'm seeing a question from Carlos Velasquez. What efforts are there to reach out to older LGBTQ adults? If perhaps somebody, Kelly, would like to take that. Uh-oh, are you there?
I forgot to unmute. Carlos is actually one of our team members, so we're really glad to have him on the call. We actually are working with his team to, again, we're trying very much to understand what the needs are, and so we're participating in forums like these to understand what the needs and concerns are of various communities throughout Virginia. But that's not all we're doing. We have a lot of research underway where we are certainly initiating a lot of different discussions so that we can get that intel. But right now we're building the fundamentals so that we understand the messages that need to be, that public health needs to communicate. And we really want to be part of this so we can have a line of communication with the communities we're trying to reach. We don't have much more than that at this point. I think this is really where those building blocks begin.
Thank you, Kelly. I'm seeing an additional question. What efforts are being made or talked about for folks who may have a hard time paying for the vaccine? I work with many trans individuals who may not have insurance or struggle financially. Marshall?
Sure, I'm happy to take that. That's a great question, and thank you for that. This vaccine is going to be made available at no cost to everybody in the United States. The early vaccine candidates require 2 doses. Some candidates might only require 1 dose, but we want to, and we are working intentionally to make sure that people understand that this vaccine is going to be made available at no cost. We know cost for healthcare can be a barrier for vaccines and for a lot of other preventive care, and especially in the case of COVID-19 vaccination, because it's so important to protect you, to protect your community, to really help bring an end to COVID-19. The vaccine is going to be available at no charge to everybody.
Thanks, Marshall. I'm seeing a question about the rationale for having multiple separate community conversations. And I just wanted to highlight that we just wanted to make sure that we were holding space for as many individual identities, and also allowing people to explore and make accommodations for where they stand in their intersection. So we wanted to make sure that we had separate spaces, but was wondering perhaps, Rose, if you could speak to why it's special and necessary for us to have intentional outreach for our LGBTQIA+ folks.
Sure, I'd love to. Well, I would say because of all the intersectionality regarding the community. So for example, you have people in the community who are African American or Latinx or Asian and Pacific Islander American. And we see that there are different inequities that affect the LGBTQ+ community differently from, for example, someone who may be a white cisgender male or a white straight man, or even an African American woman who's cisgender, right? Because there are so many even issues and concerns within like the community or within other communities when it comes to folks who are LGBTQ plus. Like, and I think that things have gotten better, but we still have these like issues, whether it's somebody who's trying to come out to their parents who may be Latinx, who may be highly involved within the Catholic Church, or somebody who might be African American and whose parents are highly involved in like the Baptist Church and may feel that they are not as accepted. And so, or we have, you know, issues or concerns regarding transgender healthcare and people going into hospitals who may face discrimination and inequities. So we just want to make sure that we can have conversations where people can come, you know, together. So whether it's somebody who is African American, Latinx, or Latino or Latina, or Native American, that there's a space literally for everyone. Because I think I would say that in terms of like this vaccine distribution and how we target it, it's going to be different for each community. And it may also be a little bit different for when we come in terms of like the Latinx community or Latino community compared to the African American community compared to the LGBTQ plus community. But we just want to make sure there's a space for everyone and for people to feel comfortable and confident in taking this vaccination. So.
Thank you, Rose. The next question that I'm seeing here, I'm going to put this one toward you, Kelly. It's another, it's specifically a question about engaging young people and what is the strategy to target that demographic group.
Thanks, Sable. So the question is about how we're going to reach young people.
Mm-hmm.
So we have, first of all, we definitely are here to build those tools, right? To get the right tools, the right messages in the hands of the messengers appropriate for those groups. And that has been kind of our approach all along. We've been working with VDH for months on the pandemic response. And in that includes a lot of work targeting young adults in the 18 to 20 something, 29 category. You know, we work certainly through a number of different methods, right? We always kind of do this on a local level, and we consult with people on the local level to understand what the needs are, because they vary from different places to different parts of the state. But I think as we move into the conversation about vaccine, again, we definitely need to understand what the concerns are that are specific for that audience. And that's why we're participating in conversations like these. And that's why we're doing the research and we're coordinating with our local partners to really get a handle on what those specific questions are so that we can be responsive to those needs.
Thanks, Kelly. Marshall, the next question's for you. The person says, I've heard that people who have allergies to meds and food should avoid the current Pfizer vaccine. Is that true? What would someone do in that case?
Sure, so that's another great question. We won't know for sure until we see the completed FDA emergency use authorization as well as the ACIP recommendations, what kind of precautions or contraindications are warranted for the COVID-19 vaccine. We do know that for most vaccines, they're safe, they're effective, and most people can get them, and they might have some side effects, a little bit of pain in the arm where they get the vaccine. They might feel a little fatigued the next day, and that's really the vaccine doing its job and your immune system working to build a good immune response. But if there are specific contraindications, in other words, reasons for you to not get a particular vaccine, that will be stated up front. So I think that's very important to know. And it's always important to talk to your healthcare provider and discuss those concerns when you go to get your vaccine. The nice thing is we've got a lot of vaccines that are in the pipeline. So if you're contraindicated, for example, to get the Pfizer vaccine because of an allergy, maybe the Moderna or the AstraZeneca or one of the other vaccines that is being developed is one that you could receive.
Excellent. And along that same line, it's a similar question, but do we have any information from the trials if being on hormone replacement therapy is contraindicated for taking a vaccine?
I'm not aware of that. I haven't seen across any vaccines that are distributed that hormone replacement therapy would be a contraindication or even a precaution. For the most part, the way that vaccines are formulated and administered, I wouldn't think that there would be any kind of interaction. Disclaimer, of course, I'm not a medical professional, and we'd look to those FDA and ACIP recommendations, but I'm not aware of any contraindications or precautions in that sort of instance.
Thank you, Marshall. Kelly, the next question is for you. It says, as a provider, I have a hard time convincing many of my clients to even get a flu vaccine with certainly warranted concerns of being immunocompromised. What sort of communications are being developed to convince patients to receive the vaccine?
Yeah, I mean, so what we try to do is we try to take a lot of information like Marshall is providing, and we try to educate the public about what what the vaccine is and isn't. And so we definitely know that there are concerns about the safety and so forth. And so we start with that. But in terms of, convincing somebody to do it, I think you really need to be armed with information and understand it. And that's the only way to do that, is to really not just provide the information, but to listen to the concerns that are there. So when people say they don't want to take a flu shot, there are a number of reasons why they don't want to do that. And really it helps to get to the bottom of what's driving it. So I guess that's where you start. You understand what the barriers are, and try to help communicate effectively about what can be addressed. Does that answer your
Kelly.
question?
Yeah. Marshall, the next question is going to be for you. The question is whether or not VDH is working with advocacy groups like Equality Virginia or other similar organizations to understand the needs and distribute information. And was also wondering if you could share with the group a little bit about our partnerships sub-working group and how they're looking to engage folks.
Sure. Well, I'll start off by saying if we're not working with any of the groups that people are thinking of, we want to be working with those groups. Just like Kelly was saying, such a big part of the work that we do to understand what drives people to get a vaccine or not want a vaccine is listening and engaging, and we want to do that. And so if your group has not engaged with us yet and is interested, please let us know. And I've seen a lot of suggestions of a lot of great groups like Equality Virginia and Side by Side that have been dropped in the chat. I think we want to engage and work with all of these groups. Carlos and Kelly and a whole team of people are really working on communications and engaging with different communities and groups to listen to them, to hear what their concerns are, what drives them to, like I said, want or not want a vaccine. And we take that to heart, and we message, and we use our communications, and we reach out to groups in different ways to try to get our message out to those groups and try to tailor our communications to those groups. So we really want to hear from you all, and we want to take that to heart and, again, really make a partnership with you. We know it's a lot of work, but we know we can't do that by ourselves, and we need those groups to really help us. They say a rising tide lifts all ships, and I think this is very much a good example of that.
Thanks, Marshall. So the next question, I'm seeing there's a lot of really great networking, folks putting their contact information in the chat and their willingness to share information and to provide additional insight to us. So thank you so much for this networking that's happening in the chat right now. I've scrolled almost to the bottom, and the next question is for you, Marshall. And if anybody else has any questions, feel free to type them in the chat or raise your hand so we can recognize you to speak it orally. But the last question that I'm seeing is, are there any issues with any medications or treatment at this point in time, including but not limited to chemo or cancer treatment?
Great question. I don't think so at this point in time based on what I've seen. And again, we're still waiting for FDA and ACIP to release their official information, but we do know that the Pfizer vaccine has been used in other countries such as the United Kingdom. And so we looked very closely at how things have kind of unfolded over there. And it doesn't look like there's a lot of, again, precautions or contraindications for the vaccine. I think it's important, though, for you to always talk with your healthcare provider to be sure that you're healthy enough to receive the vaccine and that you've had that discussion about any potential medication, side effects, concerns that you have. But the way that these early vaccines are made, they're not live virus vaccines, so there's really not a concern in terms of administering them to people that are immunocompromised. But again, I think it's always good to talk to your provider just to make sure that in your individual circumstance, you're okay to receive the vaccine.
Thank you, Marshall. I'm scrolling through. I'm not seeing any additional questions in the chat or any hands raised for folks to ask their question orally. But this is, again, just the beginning of our conversation. We're hoping that if anything else comes to mind, we have some other space for us to hear from you just on the other side of our two other speakers. Definitely before we move on to the second part of our chat today, wanting to thank Kelly Vance and Marshall Boat and Rose Miner for being on to provide some administrative framework and to give us greetings and to just share information that hopefully we can impart to our community about how things are progressing with our vaccine plans here in the Commonwealth. And I'm seeing we do have a little bit more time for question and answer. So I do see a question in the chat. Marshall, has there been any research in regard to the vaccine as it relates to HIV?
Good question. I was actually just about to type a response to that. I would say yes. When we look at how vaccines are approved, and I think that's a very important thing to focus on here, is that we haven't taken any shortcuts. We've done our true due diligence in terms of really studying this vaccine, what's helped reduce the time as we've been manufacturing the vaccine at the same time that it's been going through clinical trials to kind of cut down on the length of time it takes for the vaccine to be available. But as we go through clinical trials, early clinical trials really focus on just a small group of individuals. So we're really looking at, is the vaccine safe? Does it actually work and create an immune response? But as we go through clinical trials, we start to enroll more and more people into those clinical trials because we want to look at that data and be able to make it representative of the population that's going to receive the vaccine. So I would very much imagine that people that might have HIV infection are part of that phase 3 clinical trial. As a matter of fact, I'm certain that they must be. And we're looking at how individuals that might have HIV infection or be immunocompromised respond to the vaccine and whether or not the vaccine is safe. And in fact, because they're part of that population, part of that group for clinical trials, we can kind of extrapolate our recommendations to larger populations as a whole. And so that's why those phase 3 clinical trials are larger and have a variety of individuals so that they're representative of the population, so that we know at the end of those trials, when we look at that data, that we can apply that to the larger population and say with a great amount of confidence that the vaccine is safe and effective in those sorts of populations.
Thank you. Thank you, Marshall.
Sure
And now
thing.
we're going to hear from our community folks. So the first person we're going to hear from is James Milner, the Interim Executive Director at Virginia Pride. James, are you there?
Yes, I am. Sorry, I had to unmute myself. Hello, everyone. I'm James Milner. I'm the Interim Executive Director of Virginia Pride. I see a lot of folks here that I know, a lot of friends and acquaintances, and it's great to be a part of this. I just want to say thanks to the Virginia Department of Health and the Governor's Office for organizing this important conversation, which I hope will be the first of many, whether that it continues as sort of larger groups like this or whether there are dialogues that result from this event between those of us that have are in positions of leadership in our community or otherwise have influence among LGBTQ folks. Oddly enough, in a previous life before I moved to Richmond, I actually worked with the National Institutes of Health, specifically Dr. Fauci at the National Institute of Allergy and Infectious Diseases, on a research project and a communications campaign to determine Americans' attitudes about vaccine research and to educate them about vaccine research. And that's specifically focused on populations including LGBTQ folks, Black folks, Latinx folks. And a lot of the discussion that we've had here tonight mirror exactly what we did. We did significant national research. We did focus groups, and a lot of the issues and barriers that are in place around vaccines and people's understanding of them and their acceptance of them come from their experiences as to how they live their daily lives. Whether it is a distrust of the medical establishment, which is rooted in the Tuskegee experiments for Black folks, or as an example of that. But it's what we discovered was that the most effective way to address those issues and barriers to people accepting vaccines and understanding vaccine research was that they got their information, trusted information, and they trusted the information that came from folks that they knew in the communities and people that looked like them, whether they were community leaders, whether they were friends, whether they were family members, whether they were religious leaders. And so I think that's why this kind of conversation is so important for us to have, because I think that those of us that are participating in this obviously feel passionately about this and see that we have a role to play in ensuring that the folks that need this, the folks that will benefit from this vaccine in our community, specifically early on, I think are the ones that we need to make sure that we're providing with accurate information and being trusted arbiters of information for them. I think it's perfectly normal for people to have questions and concerns around a vaccine. I think it's also our responsibility to make sure that we are well informed around vaccines, and especially this vaccine. And obviously the folks that are asking these questions are seeking that kind of information. So again, thank you to everybody for being a part of this. I just want to say that personally and in my role with Virginia Pride, I am committed to doing everything I can to ensuring that the LGBTQ community specifically, but every Virginian, every American has access to this vaccine. I think as we have already said, COVID has completely transformed our lives from a year ago. I was looking at a Facebook memory from a year ago, actually a picture that I took of the unveiling of Rumors of War. And I thought about the fact that as I was standing there and thinking about the significance of that and what it meant for the future, I had obviously nobody knew that this was what was going to happen in the next 12 months, and how different our lives are now and how are now. But the way that we get back to any sort of semblance of normalcy is with this vaccine. So I think it's incumbent upon all of us, and I encourage all of us to do everything that we can to ensure that our community has access to this vaccine, that their concerns and their fears are addressed, and that we eliminate any barrier that exists that we possibly can to ensuring people access to this vaccine.
Thank you, James. And now we will hear from Natasha Crosby to tell us their perspective. Natasha, are you there? Oops.
Hi, can you hear me okay?
Sure can.
Awesome, thank you. I am Natasha Crosby, president of the Richmond LGBTQ Chamber. I appreciate the VDH for putting this on tonight and allowing me to give some remarks. So in rolling out the COVID-19 vaccine, I feel it's imperative that healthcare providers not only gain the trust of marginalized communities, but establish trustworthiness. There is a long history of disparities and, quite frankly, bigotry and racism within healthcare that will pose a direct conflict in gaining the trust of the communities who need this vaccine the most. No one wants to feel like a guinea pig. And as a Black LGBTQ member of this community, vaccines, they give me pause. We can reference the syphilis trials in Tuskegee, but right here in Central Virginia, there is a long history of medical injustice directed towards marginalized people of our community. This distrust, it's been earned, and it will take hard work to regain the trust of those that this was inflicted upon. So how do we do it? Making this vaccine accessible to all with no cost is a great step. But to build trust, a vocalized plan to help those who may have adverse reactions should be addressed, also with no cost associated. Let people know not only is the vaccine safe, but in the event you suffer difficulties, there will be good care available to you. Also, let's not just tell people it works. Let's show people the science. And VDH, Marshall, you guys have done a great job tonight in doing that. The medical community in working on this vaccine, they said that they would follow the science. They would not put up a vaccine that wasn't tested and sound. So making the details available to everyone could go a long way in gaining the public trust. But finally, let's be brave. Let's be courageous and name the elephant in the room and acknowledge our history and the grave miscarriage of trust our healthcare system has administered. We need an effective vaccine right now. We all know that. But we must work to gain the trust of those who have been wronged and give grace to those who will take more time to be comfortable with a vaccination. Thank you guys for your time.
And thank you, Natasha, for your comments. I think that both James and Natasha did a very good job of setting the stage and for why we are devoting the rest of our time together to hear from you in a public comment format. So there were lots of specific populations and specific needs that were mentioned in the chat earlier, but am now going to give the opportunity for the individuals who have assembled on this call to articulate. You've heard Kelly Vance and Marshall Boat talk about the importance of us, and Rose Minor talk about the importance of us being able to share the information, and for us to really, as state workers, to take a step back and utilize this opportunity to listen and observe twice as often as we speak and really hear from community what the needs are. So at this point, I'm going to step back. If you all could raise your hand so we could make sure that we have your line unmuted, and each person's going to have a minute to go through and to express a public comment. We'll be keeping time on telephone, and as soon as you hear the alarm, if you could wrap up your thoughts. But looking forward to hearing from you. You can either raise your hand in the Zoom, or you can indicate in the chat that you would like to be recognized. All right, let's see. I'm not seeing any hands raised, and I'm not seeing yet a comment in the chat box. Thank you, Marshall, for answering that question. Are there anybody who would like to make a comment?
I have a question.
Go ahead.
Can you hear me? Okay.
Yes,
I have two questions, and I'm sorry if I missed this. How it might have been mentioned, but how diverse was the population that was being tested for the vaccine? Do we know that?
Marshall, if you could, I know that we wanted to hold space, but since this person wasn't able to have their question answered before.
Sure. So I can't comment with extreme detail because I have not read the different papers and some of what has come out of the clinical trials with regards to the population. But again, when we do research on vaccine safety and efficacy, early trials use a very small group of individuals, but as time goes on in the clinical trial process, we try to get people from all walks of life, all different, underlying health conditions, areas of the country to enroll in these clinical trials, because we want to make them truly representative of the population that needs to be receiving the vaccine. So I think we're very confident that the population in the clinical trials was adults primarily. Depending on the vaccine manufacturer, the populations have been a little bit different in terms of age makeup for especially the phase 3 clinical trials. but they're getting people with underlying health conditions. They're getting people from different socioeconomic statuses and backgrounds because they want to make the results of that clinical trial applicable to the population of the United States as a whole. And of course, these clinical trials have happened in other places across the world as well. So that's something that people really strive to do in clinical trials because not only is it the right thing to do, but it gives us confidence in making recommendations. And so FDA and ACIP look at a lot of that data. A lot of it gets distilled down and then presented to them as part of making their recommendations. So I have a great amount of confidence that the population, especially in that phase 3 clinical trial, is very representative of the population of America as a whole, and the recommendations that are going to come out of that, or that are based on those clinical trials, will be sound.
Thank you. That would help with trust, I mean, in a sense.
Sure.
Right. So my other question is, what about, are we worried, concerned about the distribution with how cold we have to keep this vaccine?
That's another great question. The Pfizer vaccine in particular needs to be stored at what we call ultra low or ultra cold temperatures, as cold as -70 degrees Celsius. I heard somebody say, depending on where you are in the United States, if you walk outside in the dead of winter, it might feel that cold, and maybe we could just keep the vaccine out there, but it's not going to work. There are complexities with cold chain for at least the Pfizer vaccine, but all vaccines need some sort of a cold chain to help keep them potent and make sure that they're effective. Pfizer has done a really good job. They've actually engineered a thermal shipper that's kind of a large box that's filled with dry ice, and then the vials of vaccine are placed in that, and it can be recharged multiple times with dry ice. So you don't even need a specialized freezer that would get to those really, really cold temperatures to be able to keep the vaccine cold. Other vaccine candidates actually can be just frozen at what we would call kind of normal freezer temperature, or even stored in the refrigerator. So a lot of our planning has been surrounding how to ship and store the vaccine and have it kept at the right temperature so it can be potent and effective, of course, when it is administered. And don't worry, it gets warmed up before it actually gets administered. So you're not going to get -70 degrees Celsius vaccine in your arm when you get the vaccine.
Thank you so much.
Sure.
Thank you. So that was a bit of, thank you so much for your question. But before, and we will reserve some time if there are any other questions from our VDH team, but just wanted to again open up the floor for any comments that people have. I'm seeing that a person named Caleb had a comment in the chat. Did you want to contextualize your comment there for us to hear? Caleb?
Hi.
Hello.
Yeah, I just wanted to say that it was great that this is being made available for free, because my fiance doesn't have insurance and we were scared that we wouldn't be able to get the vaccine for him. So this was like, it was really emotional to hear that it was going to be free.
Thank you, Caleb. And I also see that Jen made a comment in the chat. Jen Galen. She was responding to the question from Susan, which really helps to set the framework for what we're trying to accomplish tonight. What are the pieces that you all would like for VDH to hear and the governor's office to hear as we're developing our COVID plan and strategies? Jen, are you there if you wanted to contextualize your comment?
Yeah, I was just basically saying that I thought that a good idea, because it was asked how to get messaging out, a good idea would just be to reach out to LGBTQ organizations in Richmond and those that we know that are serving the most vulnerable, particularly I think the trans community, and have those folks create messaging and maybe even I'm also thinking like video messaging or things like that where folks are seeing themselves represented. That way they are able to gain more trust in the vaccine, especially with what I think Natasha was saying as well.
Thank you, Jen. Before we switch back to questions, I want to see if there are any comments that people would like to make, any other important populations that we need to be aware of, any engagement strategies that we should be aware of. If you could either indicate in the chat that you would like to have your line unmuted or raise your hand so you can be recognized. Would anybody else like to make a comment?
Hi there, my name is Jerry. Can you hear me?
Yes, Jerry, we can hear you.
I work at Crossover Healthcare Ministry, and the biggest population that we serve is definitely the Latinx population, and a lot of them are undocumented. As you can imagine, many of them are very scared to even be on a call like this that has to do with the government, because they're afraid that it's gonna jeopardize their stay here in the United States. But how are we communicating towards that population to make, I would assume it's going to be also free for them, but how we're going to encourage them to also get vaccinated, because many of them, as the results come in, a lot of the people that are COVID-19 are from the Latinx, and that's because they're so scared to even go get tested because they don't have insurance, they don't have a status in the United States, so they're worried.
Thank you. Thank you so much for sharing that. I see that Berlene Lewis is trying to speak. Were you able to troubleshoot your audio issue? It looks like we might have lost them. All right, Jonathan, I see your hand raised.
Yes, hello everyone. I just want to add the comment about when messaging out to the communities and getting engagement from the community to educate those to take the vaccine, is that you provide as much information, especially when it deals with comorbidities. I appreciate all the different questions around HIV. Working in the field of HIV, that is a big concern. Is COVID-19 and contracting COVID-19, HIV and contracting COVID-19. So if we can really beef up the information about comorbidities and those that have been in the trials that might have had, different types of comorbidities and took the vaccine and the results of that would be greatly appreciated, and I think very valuable and helpful.
Thank you, Jonathan. I'm seeing that Rose has a quick question for Marshall. I just want to do one more scan for comments before I turn things over to Rose to quickly ask her question. Any other community comments? All right, Natasha?
Thanks, Sable.
Natasha?
I did want to speak to what I believe Jerry was mentioning about our undocumented community, and how this speaks to the nature of what we have come to in this fight against COVID, and how we are having to relate this to the other fights that are going on. It is unfair that people are being are dying at higher rates, or are catching COVID at higher rates, simply because they are the people who have been viewed as marginalized. And so when I speak about that, having the courage to name the monster in the room, that's one of the monsters. How are we going to overcome that idea that if I go to the hospital to go get this vaccination, I might not make it home? That is a real threat to people in our community. The same way it's a real threat to the Black community, who have been victims of vaccinations in the past, to people in the LGBTQ community who experience disparities in healthcare. We have to name the monster in the room, because without doing so, we are not really answering the questions that people in our communities actually have about these vaccines. How am I going to stay safe when the history is I haven't been safe? We have to speak to what is really the heart of why people don't want to take this vaccine, and change the minds of the folks who have put in this this idea of marginalization that has brought us to this point. Thanks again.
Thank you, Natasha. So I'm not seeing any other hands raised or any other folks who have indicated that they would want to make a comment. So I'm seeing a lot of questions pop up in the chat. So we're going to return to the Q&A portion. I'm seeing as information percolates, people have some additional questions. So I'm gonna reach out to Rose Minor. I know that you had a quick question, and then we can go back through and make sure that the rest of the questions that are in the chat box are addressed. Rose, are you there?
Yeah, I'm here. It's kind of also, it's like a, I guess, a question slash comment, and just kind of thinking about things. And I really appreciate Marshall kind of talking about like the freezers and also how cold like the vaccines actually have to be. I guess I'm concerned about, I'm also quite a little, quite a bit concerned about LGBTQ plus community members living in rural areas, just with the lack of clinics already in rural areas, as well as hospitals, as well as the fact that, you know, folks have told me that a lot of times it's, you know, people have to see a provider outside of their area, or they don't feel comfortable going into a particular clinic or receiving care. And so I'm just kind of wondering, and then you look at the transportation issue, and then I guess sometimes you look at weather too, because like, for example, in like Southwest Virginia, they can really get pounded quite heavily with snow. So I'm just wondering, like, I guess Marshall or other staff's like thoughts on like, I guess, making sure that folks who are in like rural communities, particularly LGBTQ plus people, feel like, I'm just trying to figure out how it's gonna kind of work, particularly in these rural areas where there's just not as many clinics or not as many doctors, or, you know, to see. So.
Sure, I'm happy to tackle that, Rose, and thank you for bringing that up. Virginia is a really unique state. My partner's family lives out in Rockbridge Baths, Virginia, and so when we're out there visiting them, it's very striking to me how radically different access to care is, you know, just 2 hours west of where we are here in the Richmond area. And I think we all acknowledge that, but we all have to really keep that in the forefront of our minds when we're operating in terms of looking at how to get people connected to vaccine. And so I think that's a great point, and especially the weather, all of those factors that you bring up. It's not just the number of providers that are out there. I think one thing that is really great with the COVID-19 vaccine, and it's actually come out of the federal level, is the increased ability for pharmacists and pharmacy technicians to be able to provide COVID-19 vaccine. You know, if you had told me 10 or 15 years ago, yeah, you can go to the pharmacy and get a shot, I would have said you were crazy. I go to the pharmacy when I'm sick and I need my antibiotics. Now, more than ever, pharmacists are really part of community medicine, and they're able to provide vaccines and do blood pressure checks and really help with a lot of preventive medicine. They're not just there to provide a prescription to you. And so we're really trying to engage pharmacies, pharmacy technicians, and other, I would say, non-traditional providers for providing vaccine to people when it comes to trying to get COVID-19 vaccine rather out into the communities. And I think we can really actually leverage some of, I don't want to say the quirks, but the intricacies, the things that make some of these rural communities special, because we have providers out there, be they retired nurses and doctors that maybe moved out to the country to retire, or people that we wouldn't traditionally think of as being vaccinators, but that we could train and help bring on board as volunteers to be volunteer vaccinators. We're looking at all of that to really try to have force multipliers in our workforce of people that can help administer that vaccine. And I think one thing that we really have a huge advantage with here in Virginia is our local health departments. I worked at a local health department for a number of years, and the people that work at local health departments are from those communities. They know their communities. They know how to reach out to people. They know why people might have distrust of them and how to best connect to them. And they literally know their neighbors, the people down the road that they can call on, not only to help them and their family when they're in a time of crisis, but to also mobilize people to get vaccine out to them or to be part of such a historic effort like this. So I think we're going to lean on those partnerships and those people that we know and that knowledge of our communities on a local level, and mobilize those individuals and really call them to action to get vaccine out to people. And we're working hard on that. We've got a huge hill to climb, but I think that's kind of a secret card that we have in our back pocket that we can play in this instance.
Absolutely. Thank you, Marshall. And I actually have another question for you in the chat that's come up. There was a report recently that the CDC was going to require people to submit their name, address, and other personal information in order to get the vaccine. Is Virginia going to require that?
That's a great question. And the answer is yes and no. So in order for anybody to administer a vaccine, whenever you go to the doctor, they have to verify your identity, right? And that's not necessarily your residency, but that you are who you are. So when I go to the doctor, I say, my name is Marshall Vogt, and this is my birthday. They verify that because legally, in order for them to give me a vaccine or to talk with me about my medical history, they have to know that they're talking to me. So that's part of the reason why we need to know things like your name and your date of birth when you go in for a vaccine. And we do collect some of that information, especially because with COVID-19, we're going to have to contact you to get you back for a second dose of vaccine. But the important thing to remember, there's two important things to remember. One, when we collect that information, we collect that, but we have to hold that in privacy. That is part of your bond, your trust with us in a provider-patient relationship. We can't release that information to just anybody because we're not allowed to. There are laws in Virginia, federal laws, and just the ethics of providing care to people that dictate that we have to protect that information that you share with us. Just like if you were to tell us personal information about yourself or your family or what's going on in your life, we can't share that with other people. And then also, we do have to report to CDC the number of people that we've vaccinated, but because we have to keep that information so closely protected, we've actually signed a data use agreement with CDC where we're not sending that information to them. And I'm very proud of Virginia because we take such great steps to protect health information. We actually had to work with CDC and really dial back the information that we're going to send them so that no personally identifiable information can ever be transmitted to CDC. We need to be transparent and show that we've administered a certain number of doses of vaccine to certain numbers of individuals that live in different areas of the state, but we're never going to take your personal health information or your identity and do anything that could be used to harm you, to judge you, to compromise who you are and what you do here. That's not what we're about. I really want people to understand that, especially VDH, but anyone who's administering vaccine, they have to agree to these terms and these principles. And it just comes down to being ethical and doing the right thing. And again, reducing those barriers, any stigma, anything like that, to make sure that everybody has access to vaccine. I hope you can tell that I'm really passionate about that. And I think I speak for everybody at VDH, that VDH employs people and works with people that are passionate about that as well. And we want people to know that.
Absolutely. Thank you so much, Marshall. And I see that Rachel K in the chat indicated that they had a question. Rachel, are you there?
Can you hear me?
Is Rachel K? Yes, indeed.
Okay, I don't know if my video is working. I don't think it is. My question is, do you really think that the vaccinations are going to be limited to hospitals? Like hospitals or like a official health clinic, or are there going to be, or are there plans to have any sort of mobile units that can drive out to like anywhere from rural areas to getting some it might be an easier penetration into like a community of undocumented people who don't want to enter, a large hospital where there's anybody looking around who can, guess what's going on and see your business. I know that there have been issues with maybe not here, but medical providers and other quote bystanders in those scenarios, like calling and cooperating with ICE. I know that a lot of people don't do that here. I'm from an area where that happens, or has happened. So talking about this kind of thing, I know that people might not, are there any plans or funding to deal with kind of taking things out of the like official hospital environment?
I'm happy to address that if you'd like to. I think that's a great question. And that's something that is definitely on our minds. And I think, again, local health departments are really good at that. They're kind of, and I guess I'm dating myself here because I really like MacGyver. He always had his Swiss Army knife, and that's what he relied on, and it could do anything. And local health departments are like Swiss Army knives. They know their communities and they adapt so well. And I think they have the ability to reach into their communities and reach out to their communities with mobile vaccine clinics, with clinics that are at maybe non-traditional places, to be able to go out and reach people who might not be able to come to them, and to really think proactively, as you said, Rachel, about, maybe people have distrust of healthcare. How do we reach out to those individuals? And so I think a lot of our local health departments, because they know their communities so well, are really going to be thinking heavily about that. But we're thinking about that at a state level as well. And I think what's great too is we have so many kind of non-traditional vaccinators that, maybe people are afraid of going to a hospital or, a big medical office building, but they're very comfortable being in their local grocery store and there's a pharmacy there. So they might be able to get a vaccine there. We're thinking outside the box with this. And when I think back to H1N1, over 10 years ago now, when I first joined public health after I graduated and got into the profession, we're thinking so much differently, and we're being creative. And I think that's going to make a huge difference. We're wanting to be equitable and to think through these sorts of things, and to confront any of those fears and address them and make sure that people have access to vaccines.
Absolutely. And someone in the chat indicated that they found out from their dentist that they'd received a letter from the Virginia Dental Association asking if their dental practice would like to provide vaccination. So definitely underscoring, we're seeing in real time that people are seeing that thinking out of the box that Marshall was just talking about. Wanting now to call on James Milner. James, I see that you had a response to one of Marshall's comments. James, are you there?
Yeah, I am. I just wanted to say thank you for the information around the ID requirements and that kind of thing. I think there's going to be, I think that's going to be a challenge for a lot of folks, because I think there's going to be a lot of misinformation that goes on around that, and I think that there are going to be perceptions and fears that maybe aren't based fully in fact around that are going to present huge barriers. I also worry that any sort of ID requirement is going to really discourage or prevent undocumented and trans folks who maybe have not updated their legal identifications or don't have it at all. So I think that's an area where I would suggest that we all work together on that, because I think those of us that work in those spaces will have some ideas of how to address those types of things. And whether that's through community health clinics like Health Brigade or Daily Planet or other places like that, that have a history and experience of working with undocumented populations and trans folks. I think that's going to be really key. But I think my concern is that any sort of situation in which someone has to really identify themselves in order to get the vaccine may be a challenge for a lot of people who are in fact most at risk for COVID.
That's a really great point, James, and thank you. That was eye-opening even for me as somebody, again, as you can tell, I'm really passionate about this and want people to have access to vaccine. We need to hear these comments. I think we need to hear, because we don't always think that way necessarily, and we need to be exposed to those viewpoints and those thoughts and hear them. And, you know, Kelly and Carlos, Sable K, and the Health Equity Working Group, and a lot of the other folks working on this, I think, take those, they really do take them to heart, and we want to work with you and form those partnerships to be able to maybe make some targeted outreach efforts or help allay concerns for sure.
Absolutely. Thank you, Marshall, and thank you, James. Just scrolling through to make sure I'm seeing some good conversations happening in the chat, and thank you to everyone for participating and sharing your comments and questions in the chat. And again, we're still wanting to hear from you. We have we have about 15 minutes left of our chatting time today, so just going to again step back and open up the floor to see if there are any other questions, comments, or concerns that people would like to raise for the hearing of our Governor's Office colleagues, as well as my colleagues at the Virginia Department of Health. All right, I'm seeing a question in the chat. Is it too late for residential providers to join the federal pharmacy program? Marshall?
I'm happy to tackle that one. If people were eligible to join that federal long-term care pharmacy program, they were automatically opted in Virginia. So anybody who is eligible for that should be opted in. We had some folks that maybe weren't interested, and we've kind of reached out to them and talked to them about that. So what I would encourage people to do if they're not sure is to reach out to their local health department. We've got a lot of planning discussions going on at the local level, and that local health department, again, is going to have that best relationship with these different facilities to be able to make sure that they're enrolled. And if it just in a worst case scenario they weren't enrolled in that program, that local health department could work with that entity, with that provider, to make sure that they had access to vaccine.
Thank you, Marshall. I'm seeing that C. Sumter has a comment. C. Sumter, are you there?
I am. Can you hear me?
Yes.
Yeah, so this is Charles Sumter from Safe Space Nova. Just quick question. A lot of the youth that we are dealing with, right, are maybe homeless. And so we will obviously be a conduit to them. But what's sort of the thinking or the process or the outreach campaign for folks that are homeless? That we may not get through social media or some of the normal ways of outreach. It may have to be more targeted. Is there any thought on how we can better do that? Any thinking around that?
Kelly, are you there?
Yeah, sure. Hi. So yes, I mean, we work with our local partners. We work with our local health departments. A lot of public health has been coordinating with folks for a long time on multiple levels, and so a big part of that is consulting with those groups to understand how to reach a number of people. And so a lot of those systems are in place, but I think forums like these are really, really helpful for us to understand what we're missing and how we can do better and how we can hear and understand, what is resonating, not just the message, but the way people receive information. That is a long, ongoing process. And so I think, I'm listening to the comments tonight, and I think there are clearly opportunities abound for us to really refine some of our existing channels of communication, whether it's for COVID-19 or something else. It's going to always be improved, but I think this is such an important topic, and it's really one that is it's an emotional one. It's one that definitely is an important thing that we need to be paying attention to. So I would say, we first start at the local level and we have forms like these to understand, but our ears are to the ground. And so I think, you know, if you are on this call and you have a recommendation for a better way to connect with any of the audiences you've mentioned, please send me your email address. I would be interested in speaking with you.
Thank you so much for that, for your comment and question, Charles, and for your response, Kelly. I'm seeing a comment in the chat that perhaps for the homeless, we could use some of the strategies that were used for the census. And I think that it creates natural synergy for the work that the Office of the Secretary of the Commonwealth did during those efforts. So we can apply those lessons learned. So thank you, James, for raising that in the chat. And as Kelly mentioned, this is going to be, this is just the beginning of us opening the door and continuing and starting to have these conversations. We know that not everybody who was able to register was able to join us tonight, and you may have a burning thought that hits you at like 2 o'clock in the morning. So I'm just wanting to let you all know that we are going to be following up to the individuals who have registered for this event. We are going to be sending the recording out. We've been taking copious notes about the questions that have been raised in the chat, and also for those of you all who raised questions when you registered, and we're going to be collecting all of that information to truly tailor our response to make sure that we are giving the residents of the Commonwealth the information that answers their questions and would really best serve them to make educated and informed decisions about their health and the health of their families. So just wanting to thank everyone. You all will be receiving an email from our OHE account. Thank you to our presenters. And we have about 9 more minutes left, and just really wanted to, again, just make sure that we are holding all of the space that we can, hoping that you all will accept this challenge as information ambassadors and for caring and invested members of the community to take what you've shared, what you've learned on this webinar and community conversation this evening, and share it with your community, because it's going to be us working collaboratively about how, and that's how we're going to get to the space where we are in a healthier, we're the healthiest Virginia that we can be. So thank you everyone for participating. I'm just going over just to make sure that there aren't any other questions or comments in the chat. I'm not seeing any other hands raised, but I'm loving all of this networking that's happening in the chat. I'm hoping that you all found this helpful, and we'll be having some additional conversations, especially as we get closer to general population vaccination efforts. So again, thank you to all of our panelists. Thank you to all of you all for joining us this evening, and I hope that you all have a good rest of your Thursday evening. Bye, everyone.